Good morning, Mr. Brown. How are you? I'm Brianna, your nurse. How'd you sleep tonight? Last night? Not tonight. That's all. Probably what brought you in here, I'm assuming. Yeah. Can you tell me your name and date of birth? Paul Brown, May 4th, 19XX. Perfect. And I see you have an allergy to penicillin sulfa. Oh, great. So the doctor ordered a regular saline drip. Are you okay with that? It's just an IV. It goes in your hand. All right. I'm going to put a warm pack on your hand so that it'll just help bring like the blood flow and open the veins so you can see them better. And I'm going to remove things. Okay. So what I have here is I just have 250 milliliters, and it's going to run at about 21 drops a minute. I have to get my supplies ready. Got a few extra things with me just in case. Okay. Few alcohol pads extra never hurt. All right. Okay. Perfect. All right. So I'm gonna go ahead and just open this. I have a hard time opening it. Sometimes it was pretty easy that time. Should have probably opened that before I took my lid off, but at least keeping it sterile. Okay. Things are hard to turn sometimes. I'm just going to put the date, which it's the 6th, and then I'm going to put the time, and it is 23, and my initials. And this is just so they know when to change the dressing. It's not sterile. Oh, you have an allergy to betadine? It irritates your skin? That's fine. We won't use it. We'll use alcohol swabs. I'm going to move myself a little closer and pull your bed rail back a little bit. All right. So, I'm just going to make this really tight. And look for a good vein. There's one. Okay, I'm going to loosen it for now. You can only leave it on for a minute. Okay. I'm going to just move this around, make sure that it's good. And then the facility that I work at allows us to put tape on our bed rails. Some facilities don't, but I'm lucky enough that this one does. It's kind of cold outside. Are you enjoying the snow? Me either. I'm ready for spring. It's a non-sterile technique. I'm just gonna start from the inside and work my way out, about 2 to 3 inches outward. Make sure it's nice and clean. Okay, and then I'm gonna go ahead and retie my tourniquet. It's gonna be tight, slightly uncomfortable, but be over before we know it. All right. So I'm just going to take your hand and stabilize your skin and pull downward. Okay. I'm going to slide my catheter in and make sure that it's all the way up against the skin. And then I have flashback. So I'm going to go ahead and take this and screw it on there. And then I'm going to want to make sure that I take this off before I flush it. It's going through good. All right. So I'm just going to put this right on there. Before I secure it, I'm going to take this and just clean up that blood. I don't want to leave you all bloody. Still doing all right? Good. Worst part is over. You did great. All right. And then I'm going to go ahead and take my tape. Do a Siobhan. Secretly, that is my favorite word. I love the word Siobhan. I don't know why. It's kind of nifty, huh, Mr. Brown? Okay. And then I'm just going to go ahead and take it one more time and make sure that it's nice and secure. It's great. Okay, and then I'm going to flush it. And as I do, I'm going to clamp it, and that's just putting back pressure on it. And I'm going to go ahead and discard that. And then put this one here. And I like to try and keep your tape over tape instead of tape over skin. Just reduces the irritation. Tape's not the most comfortable thing. I'm sure you've realized that. So, feeling all right? Okay. And then I'm just going to go ahead and put this on there, which is my label. Get my initials on you. Not every day somebody gets my autograph. All right, so I'm gonna run this over to the sharps container before I get further on anything else. So the doctor ordered the 250 milliliters of saline. I'm gonna go ahead and hang this up. Got my tubing. Do you have any favorite hobbies? I like to golf on the weekends. That's fun. I personally have only ever been mini golfing. I'm a pro at it. I'm just going to squeeze this, fill it to the line. Okay. And then I'm going to leave this stuff laying around his room, so I'm just going to stick it in my pocket for now. Alright. I'll hold these upside down. And prime the line. Let it open. My roller clamp back up. Who would have known the first thing you do is close off your tubing, because you don't want to get wet. There it is. Okay, I'm just going to reach over you and lay it over there. All right, so I'm just gonna go ahead and scrub this for 10 seconds. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi. And then we're gonna just lay it right there, because I don't have to scrub it again. And I'm going to flush it one more time before I hook your fluids up. I'm really bad at this, so you might get a slight shower. Alright. I still have an air bubble in there. Sometimes they're really hard to get out. Good? Pretty good. Just dropped it. Alright, now I'm going to unclamp it. Flush it. Great. I'm just going to leave it there on the alcohol pad. And going to hook this up to it. Perfect. And then just put a little piece of tape on there just to ensure that that doesn't keep coming off. Just want to keep everything nice and secure. Okay. All right. Where did it go? Well, the 250 milliliters in an hour is 21 drops a minute. I did my math before I came in here. So I have 21 drops a minute, which would be 10.5 for every 30 seconds, 5 1/4 for 15, And then 2.63 for every 7. So about every 7 seconds I need 3 drops. I'm going to slowly open this up. Okay. I'm just going to move your bed rail back up the rest of the way. Partially down. Got saline all over my fingers. And that would go in the dirty linens. Do you have any questions for me before I go? Is everything still doing good? All right. Here's your call light. If you have any questions, just push your call light and let me know. Your bed's back to the normal position. If you need to get up, push your call light and I'll help you to the bathroom or anything, or moving into your chair. If you want to move, you could fall or trip over the cords or the tubing, and I just don't want that to happen. So just go ahead and push your call light and somebody will come in and help you. Okay. My 2 nursing diagnoses are that I would, he's a knowledge deficit because I have to teach him to push the call light and not to get up because of the tubing, and like that you have to move the thing that holds the fluids. You would have to move it with him, and you don't want him to pull his IV out of place. And then the other one would be a risk for infection because you have fluids actually going into him through his veins and you punctured the skin. So, and then before I would have put the IV in, I would have gotten his vitals and done an assessment, and I didn't state that before in the video. So. And then documentation, I would sign it and date it and put my initials, and I put the IV in his right hand, and that it's more towards the pinky, and then I would also put that he tolerated it well and that everything's going okay. I would put how much fluid he has going in, what the IV drip rate is, and then I would put that it's 21 drops a minute, and then that it's 250 mLs over an hour. So